Hi everyone, this is Dr. Aparna, Neonatologist, Pediatrician from KIMS Cuddles, Kondapur, Hyderabad. So dengue is one of the commonest illnesses, viral illnesses that we see during the monsoon season. So this illness is characterized by some typical signs and symptoms that we have already discussed. And when we investigate these children, we may see some laboratory abnormalities. What are these abnormalities? Usually dengue is characterized by fall in cell counts, particularly white cell count and platelet count. The fall in white blood cell or leukocyte count and platelet count is one of the cardinal manifestations of viral dengue illness. In more severe cases where the child can lose fluid from the intravascular compartment, there can be hemoglobin concentration or hemoconcentration. So this is identified by increase in the hematocrit or packed cell volume levels in the blood test. Now, although these are vague warning signs, these can be confirmed with specific confirmatory tests, and there are few of them. One of the commonly used tests is the dengue NS1 antigen test, which is usually positive after around 1 to 2 days of the onset of the illness, and a more reasonably reliable test, which is a dengue antibody test, which is dengue IgM antibody test, but this takes a little longer to become positive. So it might take up to 4-5 days from the start of the illness for the IgM test to come positive. So if we test very early, the IgM test can come negative, but the NS1 test may come positive. Now, the IgM antibody titers may stay positive until 3-4 weeks after even recovery from the dengue illness, and in the long run, many months after the child has recovered from dengue, we may often see IgM getting replaced by IgG titers. So if you do test and you find IgG alone coming positive, it doesn't necessarily indicate a recent infection. So to summarize, the lab investigations that are indicative of dengue include a high hemoglobin concentration, especially when there is a lot of fluid loss, which is hemoconcentration, and fall in white cell count as well as platelet count. The more important markers of dengue infection in particular are the NS1 test in the early phase and dengue IgM titers in a little later phase. Thank you.